Hello, everybody, and welcome to our lecture on infection control. This is definitely a very pertinent topic for this Foundations 2 course as we are talking more about those inpatient settings. And also, with everything happening in the world with COVID, this topic takes on even more significance. All of us have had our lives affected significantly, and we are all dealing with a very fluid and dynamic situation because of this global pandemic that we're facing. So there's some chapter 4 in your mobility and context book has some great information about infection control. All throughout this lecture, you will see hyperlinks to the CDC, Centers for Disease Control website. I encourage you to spend some time clicking on those links and perusing that website. We'll talk about it more this term and quite a bit next term in health promotion and wellness. Our objectives today, we're going to talk about hand hygiene, personal protective equipment, clean versus sterile situations. We're going to talk about the various types of standard and transmission-based precautions that care providers take. And also, I talked about personal protective garments for different situations. So some definitions to begin with. There's aseptic technique. Basically, that's in more of a surgical type situation, or a lot of physical therapists are involved with wound care. And so uh, sterile field is different from general cleanliness. In the normal life of a physical therapist in the inpatient or outpatient setting, we're trying to maintain a clean environment. We are wiping down tables between patients, at times wearing gloves if someone, for example, in the outpatient orthopedic setting, if someone is a post-operative patient, perhaps we are removing those surgical dressings, so we would wear gloves for that. And right now, during this pandemic, all facilities, inpatient or outpatient, are wearing masks to protect the clinician as well as the patient. Um, and in general, as we look at cleanliness, the second big bullet point, uh, there are kind of these three levels. You know, cleaning is wiping down a table, physical removal of uh, anything that may have been left behind after a patient perhaps laid on a treatment table, for example. Disinfecting is now we're spraying some sort of chemical and wiping down. So we're taking it a step further to not only wipe a surface clean, but to disinfect it. And then sterilization is the ultimate level. You think about your surgical tools, scalpels, and various tools, and also in a dentist's office, all of their tools are sterilized with extreme heat and often chemicals to make sure there are no pathogens present. Uh, Anything that is non-sterile or touching something that's non-sterile is considered contaminated. Uh, as we've talked about in Foundations 2, we're discussing that in those inpatient settings. And so an HAI, healthcare associated infection, and you'll read different literature that talks about nosocomial infections. Basically, it's something that an infection that was acquired while in a hospital or some other sort of clinical setting. And so this can happen. Obviously, patients who are in the hospital or in a skilled nursing facility or a rehab setting, those people are sick and not as mobile as typically they would be, and often for many different reasons they are immunocompromised, and so therefore the risk of infection increases. And so this can happen between patients or between caregivers and patients. And you can see some of the numbers there. Hospital stays can increase 6 to 10 days on average just because of going in for whatever reason and then acquiring one of these healthcare associated infections. And you see the tremendous healthcare costs associated with these infections, 28 to 34 billion per year. So there are times in various inpatient settings where patients are isolated, and this protects the patient and the public. And this is not desirable, but at times very necessary. More definitions: pathogens are just any kind of microorganism that can cause disease. So in order to spread infection, these three elements are needed. And I direct your attention to the CDC article that's in Canvas that relates to C. diff. We'll talk about that organism a little bit later in this lecture, but it talks about these three elements: a source, which can be anything, a patient, a visitor, a caregiver, but then you need, so the source basically introduces the organism, and then you need a susceptible host and a means of transmission for the organism. So that's how infections can spread. A very significant problem in healthcare settings, more so in the inpatient setting. And now we see all the examples with COVID-19, and there's been so much discussion. I think all of us, our awareness has been heightened about the risk of infection spread. So there are 5 routes of transmission. We'll talk about each of these in detail: contact, droplet, airborne, vehicle, and vector-borne. So contact transmission is basically, just as the title would indicate, you come in contact with some sort of a microorganism. So that can be, you have a patient who's infected or a surface that's infected, and touching that patient or touching that surface or equipment that person touched, clothes they wore, that can be contact transmission. Obviously, infections in the skin that are highly contagious can be a tremendous source of contact transmission. MRSA, or methicillin-resistant Staphylococcus aureus, is a very difficult bacteria to overcome because it's resistant to typical treatments. We're going to talk about quite a few examples of infections or diseases that are on some level resistant to typical treatment approaches, and those become extra problematic. There's some other examples: lice, scabies, impetigo. Droplet transmission, basically close respiratory or mucous membrane contact with respiratory secretions. So the classic thing: sneezing, coughing, and also even talking. For those of you that have been in the front row during some of my lectures, you can sadly relate to this. I guess that's one of the benefits from virtual learning. You don't have to have Dr. Richardson spitting on the front row or the front 5 rows if I get really passionate about a certain topic. But just talking can also transmit these droplets. And so some of the examples: pertussis, influenza, mumps or rubella, and of course COVID-19 can be transmitted through droplet transmission. Airborne transmission is similar to droplet, but this is basically the droplets are suspended in the air, or the dust particles. I'm sure all of you have had the experience of having the light be the correct angle in a room, and you pick up a blanket or a shirt, and you see all these particles dispersing through the air. And for those of you that are extra fearful about germs or cooties, seeing something like that really gives you a visual representation of just how much is in the air and how quickly it can be spread. So airborne transmission, some of these droplets or dust particles are in the air. This can be a reason for isolation of patients. They have reverse airflow rooms in some hospitals just for patients who have airborne contagious diseases, and that basically means that in the room where they are residing, all of the air is sucked out of the top of the room and gone and placed through filters so that it cannot affect adjacent rooms. So some of those examples are tuberculosis, measles, chickenpox, and so forth: SARS, hantavirus, anthrax, norovirus, and H1N1. These are all examples of airborne transmission pathogens. So then the final 2 are vehicle transmission and vector-borne. Vehicle is just the disease is transmitted through something like food, water, or blood. That becomes the vehicle to transmit the disease. Sexually transmitted diseases would fall in this category. And then vector-borne transmission is basically third-party diseases. And the classic example are mosquitoes that can, by landing on somebody and biting them or sucking blood from them, they transmit things like malaria, West Nile flu, and so forth. That's not as common at all in hospitals. Certain parts of the world, different times of year, when mosquitoes and other fleas are more prevalent, then those vector-borne transmission routes can be more problematic. So, infection control in general. Now, here's your first hyperlink. There's a page on the CDC website that talks all about infection control. This CDC website is updated regularly anyway, but now in the last year or two with COVID-19, it's been revised probably even more on a more regular basis. And so this information addresses all of the healthcare settings, takes a broader approach. The CDC is constantly surveilling the world for different kinds of outbreaks that may be occurring. And so now, once again, I'll keep referring to COVID-19 during this lecture because it's the perfect example, sadly, in many ways, of how something can start, apparently Wuhan, China, and then spread throughout the entire world. The CDC goes to great lengths and has many resources involved to track that and make projections, give scientific information to help the public be as safe as possible. And definitely everybody involved in healthcare, we have a very specific and unique responsibility to be aware of infection control. So there are isolation precautions that exist in healthcare facilities. The three most common routes of transmission: contact, droplet, and airborne. So there are specific isolation precautions for a patient who is known to have a certain disease or infection. Also, some of these categories can be combined. So a patient may have chickenpox, for example, and that can be transmitted airborne and contact, so that patient would have both of those precautions. So in hospital settings, you will see often on the door of a room or on a floor signs, and we'll see some later in this PowerPoint, that would alert a healthcare provider and visitors of the different precautions that are in place, for example, in this room, on this floor, so forth. So isolation precautions, obviously, the whole effort is to prevent the spread of microorganisms that would be harmful. The challenge with isolation precautions, they cost more because often you'll have one patient who will be taking up an entire floor or an entire hallway or even just an entire room. Also, from the patient perspective, they are not able to have visitors. We've seen this with COVID-19. I'm sure all of you have heard stories of a family member who becomes ill or is needing to have a baby, for example, and the typical type of visitation is not possible. And from our standpoint, often these patients need to have their physical therapy treatment in their room. And part of the benefits of receiving treatment in the physical therapy gym is that socialization, seeing other patients, and that can lift their spirits and give them motivation. So while necessary in many cases, isolation precautions do have a downside that we need to be aware of. So some of these specific infections that really have an impact for physical therapists are C. diff. And so this C. difficile infection is, there's a whole article from the CDC on Canvas, as I mentioned for you, that talks about it's a gastrointestinal type of infection that is often, these patients have uncontrollable diarrhea, and it's very contagious, and often one patient can cause a spread to many, many patients, and so that's one that you'll need to be aware of. And then this other second bullet point just has many examples of drug-resistant organisms. We already talked about MRSA, a VRE, vancomycin-resistant enterococcus. So that tells you the type of bacteria, and it's resistant to vancomycin, which would be a very potent antibiotic that is usually effective, but not so with this one. And then you see the other examples. These are not things you need to memorize, but just be aware of. We need to be aware that there are certain concerns in certain locations. We work with sick people. We're a risk to them, and they can be a risk to us.